This medication, Whytederm Trilasil Pak Kit, is used to treat a variety of skin conditions, such as eczema, dermatitis, allergies, and rash. It contains Triamcinolone, which helps to reduce swelling, itching, and redness that can occur in these types of conditions. The potency of this medication depends on the strength and form that you use. It is considered a medium to strong-potency corticosteroid. For more information on the potency of your product, you can ask your pharmacist. It is important to take this medication as directed by your doctor, and the dosage may vary depending on your specific condition. It is best to take this medication at the same time each day to keep a consistent level in your body. When using Whytederm Trilasil Pak Kit, it is important to only apply it to the affected skin. Avoid using it on the face, groin, or underarms unless specifically instructed by your doctor. Before applying the medication, make sure to wash and dry your hands. Clean and dry the affected area before applying a thin layer of the medication, gently rubbing it in as directed by your doctor. Typically, this should be done 2 to 4 times a day. Avoid covering or bandaging the area unless instructed to do so by your doctor. After applying the medication, be sure to wash your hands unless you are treating the hands. When applying near the eyes, be careful to avoid getting the medication in the eyes, as it could worsen or cause glaucoma. Also, be careful to avoid getting the medication in the nose or mouth. If this happens, rinse with plenty of water. It is important to use this medication only for the prescribed condition and not for longer than prescribed. If your condition persists or worsens, be sure to inform your doctor. When you first apply this medication to your skin, you may experience burning, itching, irritation, or dryness. These effects should go away within a few days as your body gets used to the medication. If these effects persist or worsen, notify your doctor or pharmacist. It's important to remember that your doctor has prescribed this medication because they have determined that the benefits outweigh the risks of potential side effects. Most people using this medication do not experience serious side effects. However, it's essential to contact your doctor immediately if you notice any serious side effects, such as stretch marks, skin thinning/discoloration, acne, significantly increased hair growth, or small red bumps on the skin, folliculitis. Additionally, using this medication can worsen skin infections. If you notice that redness, swelling, or irritation does not improve, inform your doctor. In rare cases, this medication can be absorbed into the bloodstream through the skin, leading to potential side effects of too much corticosteroid. This is more likely in children and in individuals who use this medication for an extended period or over large areas of the skin. Contact your doctor right away if you experience unusual or extreme tiredness, weight loss, headaches, swelling in the ankles/feet, increased thirst/urination, or vision problems. Although a severe allergic reaction to this drug is rare, seek medical help immediately if you notice symptoms such as rash, itching/swelling, especially of the face/tongue/throat, severe dizziness, or difficulty breathing. It's important to note that this is not a complete list of potential side effects. If you experience any other effects not listed, contact your doctor or pharmacist for further guidance. Before using Whytederm Trilasil Pak Kit, make sure to inform your doctor or pharmacist of any allergies you may have, especially to corticosteroids. This medication may contain inactive ingredients that can cause allergic reactions. Also, let your doctor or pharmacist know about your medical history, especially if you have poor blood circulation or immune system problems. Do not use this medication if there is an infection or sore present in the area to be treated. Using corticosteroid medications for a long time or over large areas of skin can make it more difficult for your body to respond to physical stress, so be sure to inform your doctor before having surgery or emergency treatment. If used for a long time, this medication may temporarily slow down a child's growth, so it's important to have the child's height checked regularly by a doctor. During pregnancy, this medication should only be used when clearly needed, so discuss the risks and benefits with your doctor. It is unknown if this drug passes into breast milk when applied to the skin, so consult your doctor before breastfeeding. It's important to be aware that Whytederm Trilasil Pak Kit may interact with other medications, which could affect how they work or increase the risk of serious side effects. Make sure to keep a list of all the products you use, including prescription and non-prescription drugs, as well as herbal products, and share it with your doctor and pharmacist. Do not make any changes to your medication dosage without consulting your doctor first. If this medication is swallowed, it can be harmful. In case of an overdose with serious symptoms like passing out or difficulty breathing, it's important to call 911 immediately. Otherwise, contact a poison control center right away. In the U.S., residents can call their local poison control center at 1-800-222-1222, and in Canada, residents can call a provincial poison control center. It's important to take the Whytederm Trilasil Pak Kit as directed by your healthcare professional. This medication is used to treat a variety of skin conditions such as eczema, psoriasis, and dermatitis. It is typically applied to the affected area once or twice a day, and the optimal time for application may vary depending on the specific condition. Be sure to follow the instructions provided by your doctor or pharmacist for the best results. It is important not to share this medication with others. This medication has been prescribed specifically for your current skin condition. Do not use it for other skin problems unless advised by your doctor, as a different medication may be needed in those cases. Your doctor may conduct lab or medical tests, such as checking your adrenal gland function, while you are using this medication, especially if it is used for a long time or over large areas of the body. Make sure to attend all medical and lab appointments and consult your doctor for more details. If you forget to take a dose, take it as soon as you remember. If it's almost time for your next dose, just skip the missed one and take the next dose at your regular time. Don't take a double dose to make up for the missed one. Make sure to store the Whytederm Trilasil Pak Kit at room temperature and avoid freezing it. Keep it out of reach of children and pets. When it's expired or no longer needed, make sure to properly discard it. You can consult your pharmacist or local waste disposal company for the best way to do so. Avoid flushing the medications down the toilet or pouring them into a drain unless specifically instructed to do so. If you need more help, call your doctor for medical advice. In the U.S., you call FDA, 1-800-FDA-1088. In Canada, you may call Health Canada, 1-866-234-2345. Wishing you good health. Thanks for watching.